2 and 3 and 4 and 4 and autumn and 2 and autumn and 4 and 4 and autumn and 2 and autumn collide. 1 and 2 and 3 and 4 and get them sit-ups right and tuck your tummy tight and do your crunches like.
Hello everybody, welcome to Exercise It Right. Today I'm your host, Jose Cortez, and today's topic will be osteoarthritis. So what are we going to talk about in today's show? First we're going to talk about what is osteoarthritis, what are the causes, what are the symptoms, and what type of exercises should we avoid, and which type of exercises are recommended.
Osteoarthritis, also called degenerative joint disease, is the most common type of arthritis. It is associated with the breakdown of cartilage in joints and can occur in almost any joint in the body. It most commonly occurs in the weight-bearing joints such as the hips, knees, and spine. Osteoarthritis causes the cartilage in a joint to become stiff and loses elasticity, making it more susceptible to damage. Over time, the cartilage may wear in some areas, greatly decreasing its ability to act as a shock absorber. As cartilage starts to deteriorate, tendons and ligaments stretch, causing pain. If the condition worsens, the bones could eventually start to rub against each other and cause severe pain. As you can see from the provided pictures, osteoarthritis is more common in the weight-bearing joints, such as the hip and the knee. Osteoarthritis affects nearly 21 million people in the U.S. Osteoarthritis can start to develop as early as your 20s or 30s. The chance of developing OA can increase significantly with age. In people over 50, women are more likely than men to develop this painful disease. Even though the direct causes are unknown, some potential causes of OA include obesity. Obesity increases the risk for osteoarthritis of the knee and hip. Injury. Injuries contribute to the development of osteoarthritis. Joint overuse. Certain jobs require a lot of stress on some joints, which may contribute to OA. Genetics. Some people are just naturally susceptible for developing OA. So how do you know if you have OA? Some common symptoms include joint aching and soreness, especially with movement of the body, pain after physical activity, pain after overuse, and joint swelling and joint fluid accumulation. So I bet you're all wondering out there, where does exercise come into play?
Today we have a special guest on our show. His name is Chris Pontius, and he is a current member of Jackass. So today he's going to show us the type of exercise that you definitely should avoid if you have osteoarthritis. Basketball, another type of high-impact activity, should also be avoided, and this is due to the excessive strain on the joints. So, if you'll excuse me a bit, I'll show you how to get things done in the paint. Also on today's show, we're going to have Daniel Gates, three-time Tour de France champion, and he's going to demonstrate why running at high speeds on a treadmill is not recommended for anybody with osteoarthritis.
A study conducted by the University of Western Australia evaluated the effects of stress levels applied to the knee from common endurance activities. Some activities that were studied were walking, cycling, and jogging. 3 knee designs were evaluated to determine which activities were considered safe post-surgery. The results from this study suggested that participants should incorporate more cycling and walking activities into their workouts due to the lower stress levels applied to the knee. The study also suggested that jogging should be minimized as much as possible to avoid injury. As seen here by Daniel Gates, walking is one of the most recommended activities due to its safety and low stress that is applied to the knees and joints. But don't forget about strength training. Strengthening exercises are known to increase the strength of muscles that supports the joints affected by osteoarthritis. Demonstrated by Chris Pontius, aerobic exercises such as cycling can help improve cardiovascular fitness, control weight, and improve overall body function. However, smoking is one habit that should definitely be avoided if possible. So what are the benefits for people with osteoarthritis? Well, you could have improved posture, better movement in the joints, reduced joint pain, improved outlook on life, and have a better maintenance of daily activities.
As you can see, physical activity can play a key role in people with osteoarthritis. With so many benefits such as improved posture, better outlook on life, and decreased pain in the joints, it's so hard not to consider exercise. Overall, the exercise benefits can outweigh the costs. So, exercise is highly recommended. Until next time, I'm your host, Jose Cortez. So keep those bodies pounding and keep that heart pumping.
As you shoot across